Welcome guys to Jumadeconsulting channel. At your request I made this video. Without much ado I present to you the AMT Medical Laboratory Scientist Certification Exam Past Questions and Answers Set 1. 1. A process that monitors the accuracy and reproducibility of results through the use of control specimens. Answer: quality control. 2. What demonstrates an abrupt change from the established average value of the control for 3 days in a row? Answer: shift. 3. A means by which quality control between laboratories is maintained. Answer: proficiency testing. 4. What are specific microscopic tests, wet mounts, potassium hydroxide, preparations, Fern test, performed by a physician for his or her own patients? Answer: provider-performed microscopy, ppm. 5. What category of bioterrorism agents has the following characteristics? Pathogens that are rarely seen in the United States. These agents have the highest priority. Organisms in this category pose a risk to national security because they can be easily disseminated or transmitted from person to person, result in high mortality rates and have the potential for major public health impact. Answer: category A. 6. What category of bioterrorism agents has the following characteristics? These agents have the second highest priority and include pathogens that are moderately easy to disseminate, results in moderate morbidity rates and low mortality rates, and require specific enhancements of the CDC's diagnostic capacity and enhanced disease surveillance. Answer: category B. 7. Agents: anthrax, botulism, plague, smallpox, tularemia, filoviruses, and arenaviruses are classified as. Answer: category A. 8. Class C fire extinguishers are used for. Answer: electric equipment. 9. OSHA has defined _blank as blood and blood products, contaminated sharps, pathology waste products, and microbiological waste. Answer: infectious waste. 10. All employees who work with hazardous chemicals will be required to be trained about the new labels and the elements of the Safety Data Sheet, SDS, by December 1st of _blank. Answer: 2013. 11. Material Safety Data Sheets, MSDSs, are now called. Answer: safety data sheets. 12. The GHS brings with it a new chemical labeling standard using blank. Answer: pictograms. 13. The chemistry methodology that is based on the fact that substances of clinical interest selectively absorb or emit electromagnetic energy at different wavelengths is. Answer: spectrophotometry. 14. Reference materials about the individual chemical are provided by all chemical manufacturers and suppliers by means of. Answer: Material Safety Data Sheet, MSDS. 15. How many milliliters, ml, of 0.25 m NaOH are needed to make 100 milliliters of a 0.05 m solution of NaOH? Answer: 20 milliliters. 16. Convert Celsius to Fahrenheit. Answer: 9/5 Celsius degrees number plus 32. 17. The microscope commonly used in cellular biology that has the ability to distinguish between living and dead cells and monitor activity within living cells is the. Answer: fluorescent. 18. The objective that should never have oil used on it is the. Answer: 40x objective. 19. If a 10x eyepiece is used with a 45x objective, the total magnification is. Answer: 450. 20. What is the order of draw of multiple evacuated tubes? Answer: blood culture, aerobic, blood culture, anaerobic, blue, red, green stopper, lavender, and gray. 21. What are the two general sources of blood for clinical laboratory tests? Answer: peripheral, or capillary, blood and venous blood. 22. What is the order of draw for capillary specimens? Answer: blood gases, slides, smear, EDTA tubes, other additive mini containers, and serum containers. 23. Failure to apply sufficient pressure to the venipuncture site could result in. Answer: a hematoma. 24. What would cause the constituents, including enzymes acid phosphatase, lactate dehydrogenase, LDH, and aspartate aminotransferase, AST, to significantly elevate the value obtained for these substances in serum? Answer: hemolyzed specimens. 25. The role of the phlebotomist has never been more important to the patient and the laboratory. How many errors are caused by pre-analytical errors? Answer: 2/3. 26. A Western blot is used to detect. Answer: RNA. 27. Which of the following may be said to be true of fluorescent spectroscopy? Answer: high sensitivity and high specificity. 28. In what manner is the dye uptake by a sample following electrophoresis and staining related to the sample concentration? Answer: directly proportional. 29. The measurement of the decrease in intensity of an incident light beam as it passes through a solution of particles defines which method? Answer: turbidimetry. 30. The kidney has a function of secretion of some hormones. Which hormone is regulated by blood oxygen levels? Answer: erythropoietin. 31. The calculation of which of the following renal function tests are becoming the standard laboratory method for determining glomerular filtration rate, GFR? Answer: creatinine clearance. 32. A patient with hyperparathyroidism will have which type of kidney stone? Answer: calcium oxalate. 33. A patient with an acute HBV infection would be expected to have which set of serological test results? Answer: HBs Ag+, total anti-HBC+, IgM anti-HBC+, anti-HBs. 34. The immediate precursor of bilirubin is? Answer: biliverdin. 35. You have AA patient sample that has a slightly elevated ALT, LD and bilirubin with a very elevated GGT and an elevated alkaline phosphatase. What might be the patient's diagnosis? Answer: intrahepatic cholestasis. 35. Insulin-dependent diabetes is usually diagnosed in children and young adults and was previously called juvenile diabetes. Is? Answer: type 1. 37. A hormone secreted by the pancreas after a meal responds to high glucose levels, promoting glucose entry into cells is blank. Answer: insulin. 38. Plasma proteins are the most frequently analyzed of all proteins. What are the two major measured plasma proteins? Answer: albumin and globulin. 39. The highest levels of this enzyme are seen in pernicious anemia and hemolytic disorders. Answer: total LDH. 40. What enzyme catalyzes the breakdown of starch and glycogen, and begins to increase in concentration in the blood 2 to 12 hours after onset of an attack and peaks at 24 hours? Answer: amylase. 41. Which of the following is a condition of deposition of plaques in the blood vessels that has been proven to lead to coronary artery disease? Answer: atherosclerosis. 42. The best marker combination of assays for the diagnosis of an acute myocardial infarction follows. Answer: myoglobin, troponins, and CKMB. 43. Which tissue is considered the richest source of acid phosphatase? Answer: prostate. 44. The patient presented at the clinic after returning from a fishing trip. Chief complaint is left-sided anterior chest pain that started 3 days ago. Patient states no injury. Which cardiac test would give the physician the best picture of diagnosis? Answer: TNI. 45. What is stimulated by the hormones glucagon, cortisol, and thyroxine? Answer: gluconeogenesis. 46. What hormone is hydrophobic and insoluble in water? Answer: steroid hormones. 47. The endocrine gland, once thought to have no role in the physiology of adults, but now known for its crucial role in T-cell maturation, is the? Answer: thymus gland. 48. This class of lipoprotein is produced by the liver and transports excess cholesterol from the tissues to the liver. Answer: high-density lipoprotein. 49. Lipid metabolism involves 4 distinct pathways. Which pathway takes newly synthesized chylomicrons and then goes to the liver to convert some cholesterol to bile acids? Answer: Exogenous pathway. 50. What electrolyte is essential for myocardial contraction? A decreased level of this analyte impairs cardiac function and produces irregular muscle spasms, tetany. Answer: calcium. 51. A decrease in ionized calcium often is caused by. Answer: increase in blood pH. 52. The mathematics modeling of drug concentration in circulation which helps assist in establishing a dosage regimen is. Answer: pharmacokinetics. 52. The main purpose of this assay is to monitor breast cancer patients after mastectomy. It is positive in patients with other conditions, including liver disease, some inflammatory conditions, and other carcinomas. Answer: CA15-3. 53. A complex of 3 proteins that bind to the thin filaments of striated cardiac or skeletal muscle and regulate muscle contraction is. Answer: troponin. 54. What is elevated in carcinomas and benign disease of various organs, including pelvic inflammatory disease, PID, and endometriosis, but it is most useful in ovarian and endometrial carcinomas? Answer: CA125. 55. Which of the drugs of abuse are a group of psychoactive compounds found in marijuana? Answer: cannabinoids. 56. This marker is strongly suggestive of pregnancy or a malignant tumor such as endodermal sinus tumor, teratocarcinoma, choriocarcinoma, molar pregnancy, testicular embryonal carcinoma, or oat cell carcinoma of the lung. Answer: human chorionic gonadotropin. 57. What is derived from the iron-containing heme portion of hemoglobin, which is released from the breakdown of RBCs? Answer: bilirubin. 58. What are elevated in patients with pancreatic, hepatobiliary, colorectal, gastric, hepatocellular, pancreatic and breast cancers? Its main use is as a marker for colorectal and pancreatic carcinoma. Answer: CA19-9. 59. Which type of antibiotic would you see tested only on inpatients because they are not well absorbed from the gastrointestinal tract? Answer: aminoglycosides. 60. Many cardiac conditions are treated with drugs, but only a few require TDM. The 2 classes of drugs that need monitoring are the cardiac glycosides and the antiarrhythmics. Which drug belongs to the glycosides? Answer: digoxin. 61. An inflammation-sensitive protein that can be measured by immunoassays is. Answer: C-reactive protein, CRP. 62. What is the term for bacteria that stain purple, blue as a result of retention of crystal violet iodine complex? Answer: gram-positive. 63. What is the process used to decrease the number of microorganisms that are present on the skin? Answer: antisepsis. 64. Staphylococcus spp. When gram-stained properly generally appear as. Answer: gram-positive Kochi in clusters. 65. A nosocomial infection occurs when the. Answer: patient acquires the infection while in the hospital or healthcare facility. 66. Which of the following specimens would be unacceptable for anaerobic culture? Answer: gingival swab. 67. What is resistant to heat, cold, drying conditions, and chemicals and therefore able to survive under extremely unfavorable conditions? Answer: spore. 68. What is an example of a differential stain that separated bacteria into 2 groups based on their reaction, gram-positive and gram-negative? Answer: gram stain. 69. The stain that is commonly recommended for use to differentiate parasites such as malaria in blood smears is. Answer: Giemsa stain. 70. The principal adult hemoglobin, hemoglobin A, contains. Answer: 2 alpha and 2 beta chains. 71. Morphologically, anemias are generally classified as. Answer: normochromic normocytic, macrocytic, and hyperchromic microcytic. 72. What represents an abnormal distribution pattern of RBCs, which stick together or become aligned in aggregates that look like stacks of coins? This arrangement is a typical artifact in the thick area of blood films. Answer: rouleau formation. 73. A group of anemias that demonstrate mild to severe microcytosis and hyperchromia are disorders in the synthesis of globin, a component of the hemoglobin molecule, and are a group of inherited disorders of hemoglobin synthesis. Answer: thalassemias. 74. Megaloblastic erythrocytes have an abnormal developmental sequence. As they develop, cells of the megablastic sequence have a more open or immature chromatin pattern in the nucleus, referred to as. Answer: asynchronous maturation. 75. In simplified terms, iron deficiency anemia may result from the following. Answer: decreased iron intake, either from inadequate diet or impaired absorption, increased iron loss, generally from chronic bleeding from a variety of causes, an error of iron metabolism, sideroblastic anemias, and/or increased iron requirements in infancy, pregnancy and lactation. 78. Which cytochemical stain is used to help distinguishing acute lymphocyte leukemia from malignant lymphoma? Answer: terminal deoxynucleotidal transferase, TDT. 76. A differential shows extreme leukocytosis, normal RBC morphology with possible NRBCs, and exhibits a shift to the left with all stages of granulocyte maturation. Which disorder is this? Answer: chronic myelogenic leukemia. 77. Which stage of neutrophil has a nucleus with fine chromatin nucleoli and a granular cytoplasm? Answer: myeloblast. 78. Nucleated erythrocytes may falsely elevate leukocyte count, which a correct leukocyte count must be performed as a corrective procedure. State the correct formula to correct leukocyte count. Answer: SAD face, leukocyte count x 100, 100 plus hash of NRBC. 79. The lifespan of the neutrophil is spent in 3 compartments. Which compartment is the site of differentiation, proliferation, and maturation? Answer: bone marrow. 80. What is the major humoral factor regulating platelet development which influences all stages of megakaryocyte production? Answer: thrombopoietin. 81. When counting platelets using the UNOPIT system, a manual method, which area is used to count on the Neubauer hemocytometer? Answer: large center square. 82. What is the first part of the staining process for morphological examination? Answer: methanol fixation. 83. On blood films prepared with right stain, abnormally early release of the RBCs from the marrow into the peripheral blood is indicated by the presence of nucleated RBCs or polychromatophilic macrocytes, also known as. Answer: shift cells. 84. An erythrocyte still possessing RNA is referred to as a reticulocyte. 85. What supravetal stains bind, neutralize, and cross-link ribonucleic acid, RNA? Answer: new methylene blue method. 86. In the vast majority of infections, there is at least some increase in the ESR. What are 2 exceptions? If this video OD giving you value, please subscribe to my channel, share, like and comment. Your engagement fuel my creation of the videos. Answer: chorea and undulant fever. 87. What is used to evaluate size distribution curve of leukocyte data and allows visualization of subpopulation of cells based on their relative sizes? Answer: histogram. 88. Analyzing the quality control results. Who developed the rule that is used to evaluate control results when 2 or more levels of control material are used? Answer: Westgard. 89. Which principal automated hematology analyzer allows the simultaneous analysis of multiple characteristics through a laser light beam? Answer: flow cytometry. 90. Which automated blood cell counting principle is based on increased resistance that occurs when a blood cell with poor conductivity passes through an electrical field? Answer: impedance. 91. Which cellular constituent of blood contains the vital protein hemoglobin? Answer: erythrocytes. 92. While performing a microscopic evaluation on a peripheral blood smear, you notice the color is excessively pink. What could be the cause? Answer: prolonged washing. 93. B lymphocytes differentiation is complex and proceeds through both an antigen-independent and antigen-dependent stage. culminating in the generation of mature, end-stage, non-motile cells called answer, plasma cells. 94. Test for the vascular factors include the capillary fragility test and answer, bleeding time. 95. What is a test system to assess platelet-related primary hemostasis with greater accuracy and reliability than bleeding time? Closure time, court. 96. Particle agglutination is used for detecting D-dimers associated with answer, disseminated intravascular coagulation, DIC. 97. Current tests for platelets include answer, platelet count, platelet aggregation assays, platelet adhesion, and clot retraction. 98. What laboratory test has the following characteristics? Its purpose is plasma factors. It measures concentration and activity of fibrinogen in stage 3 and monitors Tumor therapy. Answer, thrombin time. 99. The activity of factor V in plasma deteriorates even when the plasma is frozen. It is the most unstable of the coagulation factors and is also known as answer, labile coagulation factor. 100. Given %T, how is absorbance calculated? The answer is 2 log %T. Thank you for watching. Watch out for next video.